The state school COVID dashboard got an update. It now lets you see new cases reported this school year.
But many of these numbers are missing. So tonight, our Rich Nye has the plea from health leaders to help gather more accurate data on the Delta variant surge that we're seeing across Indiana classrooms.
Since school started in late July, COVID cases in the classroom have quickly climbed to the highest level since the state started keeping track a year ago. More than 4,400 cases have been reported in the past week, with a one-day record high of 1,317 cases August 23rd. But the actual numbers are probably higher.
It is clear that many of our schools this year are not reporting. We do know, because we get lots of calls from school nurses, from parents, from other concerned individuals in communities, that there are many students being quarantined sometimes, but not positive cases reported.
The state health commissioner says over 1,200 schools, more than half the schools in the state, have not reported COVID data this school year.
It is difficult to know exactly what's happening when schools are not willing to report cases and not willing to report close contacts. And we are working with the schools very closely and talking to the Department of Education about what future actions or supports could be given to schools that are doing the right thing here.
Schools are required to report confirmed positive COVID cases to the local and state health departments within 24 hours.
There are a lot of schools that are working very, very hard to report their cases, and it takes them a lot of time to do the contact tracing, to call parents, explain the situation to them. So I really want to give a shout out to the schools that are doing that.
The state dashboard shows zeros for IPS schools like Shortridge High School, with no data reported this year or last. But IPS provides its own online dashboard with even more detailed information for more than 70 schools.
Now, we reached out to IPS early today to ask why the state wasn't receiving COVID data from IPS. Our request was acknowledged, but we haven't received an answer.